3 patients. Here we go. Hello, everyone. It's Thursday, December the 2nd. Very regretfully and unfortunately, I've got to read to you that we've lost 77 more West Virginians. The 4,869th death is a 70-year-old female from Braxton County. The 4,870th death, a 92-year-old female from Hardy County. The 4,871st death, a 77-year-old male from Marion County. The 4,872nd death, a 70-year-old female from Mercer County. The 4,873rd death, an 86-year-old female from Lincoln County. The 4,874th death, a 92-year-old female from Pleasants County. The 4,875th death, a 68-year-old male from Preston County. The 4,876th death, an 83-year-old female from Tyler County. The 4,877th death, a 56-year-old female from Calhoun County. The 4,878th death, a 63-year-old male from Clay County. The 4,879th death, a 46-year-old male from Putnam County. The 4,880th death, an 87-year-old female from Marion County. The 4,881st death, a 75-year-old male from Nicholas County. The 4,882nd death, a 96-year-old female from Mineral County. The 4,883rd death, an 82-year-old male from Grant County. The 4,884th death, a 72-year-old female from Kanawha County. The 4,885th death, an 89-year-old female from Webster County. The 4,886th death, an 85-year-old male from Mingo County. The 4,887th death, a 71-year-old male from Ohio County. The 4,888th death, and a 78-year-old male from Nicholas County. The 4,889th death, a 64-year-old male from Ohio County. The 4,890th death, a 79-year-old female from Mingo County. The 4,891st death, This just kills me. I mean, it's just so sad. The 4,891st death, a 27-year-old female from Putnam County. The 2,892nd death, a 64-year-old male from Greenbrier County. The 4,893rd death, a 67-year-old male from Berkeley County. The 4,894th death, a 69-year-old male from Jackson County. The 4,895th death, an 86-year-old female from Marion County. The 4,896th death, a 55-year-old male from Raleigh County. The 4,897th death, a 51-year-old male from Kanawha County. The 4,898th death, a 73-year-old female from Lewis County. The 4,899th death, a 90-year-old female from Raleigh County. 4,900th death in West Virginia. It's unbelievable. An 86-year-old male from Cabell County. The 4,901st death, a 65-year-old female from Raleigh County. The 4,902nd death, a 68-year-old male from Berkeley County. The 4,903rd death, a 53-year-old female from Cabell County. The 4,904th death, a 76-year-old female from Putnam County. The 4,905th death, an 87-year-old female from Harrison County. The 4,906th death, a 68-year-old female from Kanawha County. The 4,907th death, a 77-year-old female from Kanawha County. There's 38 reconciliation deaths that we have in addition to the ones that I've already read. The 4,908th death, a 97-year-old male from Kanawha County. The 4,909th death, a 41-year-old female from Ritchie County. The 4,910th death, an 81-year-old male from Harrison County. The 4,911th death, a 69-year-old female from Logan County. The 4,912th death, an 83-year-old male from Cabell County. The 4,913th death, a 70-year-old male from Greenbrier County. The 4,914th death, a 79-year-old male from Mingo County. The 4,915th death, a 61-year-old male from Upshur County. The 4,916th death, a 75-year-old male from Raleigh County. The 4,917th death, a 69-year-old male from Doddridge County. The 4,918th death, a 67-year-old female from Wyoming County. The 4,919th death, a 102-year-old female from Wood County. God bless her in every way, and thank you so much for all the wisdom that you gave all of us. The 4,920th death, a 70-year-old female from Wyoming County. The 4,921st death, an 80-year-old female from Kanawha County. The 4,922nd death, a 47-year-old male from Wyoming County. The 4,923rd death, an 80-year-old male from Marion County. The 4,924th death, a 43-year-old male from Monongahela County. The 4,925th death, a 74-year-old male from Hancock County. The 4,926th death, a 73-year-old male from McDowell County. The 4,927th death, an 80-year-old female from Logan County. The 4,928th death, a 54-year-old female from Kanawha County. The 4,929th death, a 75-year-old female from Kanawha County. The 4,930th death, a 77-year-old female from Greenbrier County. The 4,931st death, an 84-year-old male from Ohio County. The 4,932nd death, an 83-year-old female from Ohio County. The 4,933rd death, a 74-year-old female from Mineral County. The 4,934th death, a 94-year-old female from Mingo County. The 4,935th death, a 59-year-old male from Mercer County. The 4,936th death, a 52-year-old female from Mercer County. The 4,937th death, a 77-year-old female from Hampshire County. The 4,938th death, a 51-year-old male from Preston County. The 4,939th death, a 78-year-old female from Mercer County. The 4,940th death, an 83-year-old female from Hancock County. The 4,941st death, a 78-year-old male from Mineral County. The 4,942nd death, a 52-year-old male from Wyoming County. The 4,943rd death, a 93-year-old female from Kanawha County. The 4,944th death, a 72-year-old female from Nicholas County. And the 4,945th death in West Virginia is an 84-year-old male from Summers County. I want to apologize to you too for us getting started late. There's just a pile of stuff that we got behind on today, you know, and getting here and getting taken care of all the other stuff. So our First Lady's doing stuff, you know, in regard to Christmas and everything over at the mansion right now, and we just got behind, so I'm sorry. The number of active cases in West Virginia is 7,113. The new positive cases are 1,446. The daily positivity rate is at 9.10. Our cumulative positive rate is at 6.24. We have 285,357 that have recovered. We've still got 569 people in the hospital and 190 in the ICU units, and 94 on ventilators. We got 1 Greene County, West Virginia, and 22 red ones right now. There are 19 outbreaks in the schools in 14 counties and a confirmed number of 374 kids or people. Reminder, as I do all the time, you're 65 and older. If you've got any kind of compromised health issues or anything like that, anything whatsoever in your life, forget the compromised health issues. If you're 65 and older and you feel like you've been exposed, you feel anxious, you feel any symptoms whatsoever, get tested, please. Please, please, please. I haven't told my people this that are here and everything, but yesterday I was around a bunch of kids, and lo and behold, we had a bunch of them that tested positive and everything, and that got sick. I'm going to get tested. Just as soon as we get through with this briefing, I'm going to get tested. You know, it's exactly what you should do. You know, if you feel any anxiety or you feel any symptom at all, get tested. Just please get tested. From the standpoint of the antibodies, they'll save your life if we can catch this early enough. And believe me, if you're 65 plus and you have any kind of issue whatsoever and you get this, you're in real trouble. Real trouble. I encourage you to wear your face coverings if you're 65 and older and you have a compromised health issue, diabetes, lung problems, heart problems, whatever it may be, and you're in a crowd of people indoors, you should wear your mask. You know, the boosters are available to people 18 and above. FDA's approved everybody and is encouraging now, thank God, we're finally, doing the right thing there. The other thing is in regard to our boosters, I've said it over and over and over, we have, and I don't remember exactly what the percentages were, but I think it was like 23% of our people that are 50 and older, and 31% of our people 65 and older that are fully vaccinated and have absolutely not taken their booster shot. Now that is not smart. It's just plain not smart. So we need to be doing that. And so run to the fire, get your booster shots. If you've lost your card, call DHHR. There's really no need in just beating the same drum over and over and over. We've got a high number of people 50 and older that have absolutely gotten their vaccinations and everything. We're making real progress from a standpoint of 18 and older. Everybody in the whole population, 18 and older, we have 68.9% that have their first dose, but we're lagging behind on people getting our booster shots, and absolutely we still could have a whole lot more work with the people that are 5 to 18, 5 to 17. We need more and more of those kids, that get their first and then their second vaccination if needed. Okay, from a standpoint, who's eligible, 5 and older, all the info stuff is on our COVID, hotline that's up there, and our grand families, I've been through the incentive program, it's running out. December 15th, it's over. So if you're not in the thing right now, you better really hurry to get in there. We're throwing money away there. Grand families, get registered. All of our testing's free. I thank Frith and Walgreens over and over. 47 outbreaks in our long-term care facilities, 2 outbreaks in our church communities. We kind of narrowed that down just a little bit in Nicholas and Webster counties. We have 28 inmates and 25 staff cases and everything. It's not too bad. The flus, get your flu shots. You can do it at the same time as a booster or a vaccination, either one, you can do it. I encourage the renters, I encourage the landlords, call us. You're wasting a bunch of money here. If you'll just call us and we can get you registered and everything, you qualify, we'll send you money. Okay, I do it for baby dog stuff and everything, round 3, all that's going really, really well, and we continue to have education savings funds for kids, significant education savings funds. I want to talk to you about a senior program that we're going to start, very, very, very soon. And this, I want to talk to you just one second about tourism, another incredible bit of recognition to the state of West Virginia. And I may mispronounce this, but I think it's Condé Nast, and their travel guide and everything. The Condé Nast Traveler has just, can you imagine this? Can you really imagine this? The one thing that has really turned the dial is, when I walked in the door, the very first state of the state, I said at that point in time that West Virginia needed to put a stake in the sand to say we were going to try to make education our centerpiece. Now, we've done lots and lots of stuff there. And along the way, whether it be roads to prosperity or diversification or tourism or our vets or our seniors, all the different things that have gone on. Lo and behold, West Virginia is really cooking and really, really doing it. And with all of that, this organization, along with Time Magazine and along with, and I'm trying to recall the other organization that just came out and ranked West Virginia in the top 10 or the top 22 in the entire world and it was, I think it was the Lonely Planet, you know, travel guide or organization. But now just think about this. Just think. West Virginia, the place, like it or not like it, that we knew was great. But people in the outside world always looked at West Virginia as backward, poor, dirty. You know, they always looked at West Virginia with a very, very, very difficult look. Now, with all of that, we started changing, did we not? We put that stake in the sand about education. We absolutely made a real commitment to our roads. And before you know it, we became diversified. We didn't forget our energy industries. And lo and behold, now you know what is happening. The world is awakening to the fact that this is the diamond in the rough they missed. Can you imagine? Can you really imagine that this Condé Nast traveler has designated West Virginia as one of the top 22 places in the world to come to? Can you imagine Lonely Planet placed West Virginia, I think, in the top 10 to come to? Time Magazine, over and over and over. We are becoming really noticed. We knew how great we were. We needed to turn the world loose. We needed to change our image, and we did it. And we thank these people. We thank the Condé Nast people, the Lonely Planet people. We thank Time Magazine. You know, there are so many things that are happening in this great state. On and on and on. We have a new national park. You know, so many great things that are happening here. Look at all the upgrades we've made to our state parks. Look at all that is just happening. For crying out loud, I was with yesterday some people from Chicago. Those people were from Chicago, and I was trying to do anything and everything I could to pick their brains and everything and see just how many more opportunities West Virginia could really develop. You know, one of the things they said, we've been in West Virginia the last couple of days, and we've been all over West Virginia and all these roads and hollows and mountains and everything else, and we cannot imagine. We can't believe the quality of the roads. The roads are unbelievable. God knows I wish we had this in our state. It's good stuff, really good stuff. I've got some more good stuff or people to recognize here. We now have a brigadier general, a lady, a brigadier general, the first female to be promoted to brigadier general status in the state of West Virginia in our National Guard in history, the first ever. So we congratulate in every way our new Brigadier General, and I hope I pronounce this right, Munger, but she is absolutely the first in history, and we think it is just wonderful beyond belief. I think it's Michelle M. Munger. So thank you so much, and God bless you, and absolutely we're very, very proud, very, very proud. Okay, I want to touch on this pretty quick because we're trying to hustle along here, but the revenue numbers just came out, you know, and I think they came out yesterday or the day before, and, you know, I promised you a rocket ship ride. I promised you that when I walked in the door. And really and truly, because I believe just this, you know, like it or not like it, but God above has given me just this gift. You know, I can look at something and most generally I can tell you what will work and what won't work. And when I looked at our state, I can never get away from just these principles. The best people on the planet, the very best people we have. We're located in the sweet spot. We're not very far from 2/3 of the population of the country. 4 unbelievable seasons and unbelievable natural resources beyond belief. How in the world could we pitch 50th over and over? And so we started. We started because I truly believe that people that have real passion, and God knows I've got that, and absolutely we started down the path. We started down the path to diversify. We started down the path to absolutely help our educators and help our seniors and help our vets and absolutely make a real life commitment to tourism and absolutely do our roads. And lo and behold, now, here we are. And the rocket ship ride that I promised, you dadgum right. You're riding it right now. Lowest unemployment numbers in the history of the state. Revenue numbers that are the highest, the most historic in the history of the state. And there's lots more to do. And all we got to do is absolutely stay the course. Stay the course. We did it without a whole bunch of growing government and wasteful spending. We did it. Now, what we need to do is just continue to absolutely make this multiply and understand there's still rocks and there's still folks out there that we really need to help. There's rocks that need to be flipped to understand exactly who we can help and what more we can do. Absolutely. Absolutely. $1 billion rainy day fund and on and on and on. You know, lots of people have put in a lot of licks. I thank all those that absolutely put in the licks, and we've got more and more and more to do. This is one hell of a ride, and it's just going to get better. I think I got a couple more things. I want to talk to you just 1 second about a senior incentive program, and this came from General Hoyer after our briefing on Tuesday. But General Hoyer said, "How about this? How about, because we have a big lag going on right now with our seniors that have that are older, over 65 or over 50." That absolutely are 23% or 31% have taken their booster shot. People that are vaccinated have taken, we have a real serious need to motivate them in every way to get that going. And so we're putting a program together where we're going to go to all 55 counties, or we're going to do something in all 55 counties, and with all of our seniors there and everything, to do more and more and more to promote them to get the booster shot. But we'll let you know a little bit more about that in the days to come. But we're working it, and that's what we're going to keep on doing. That's all I've got.
All right, thank you, Governor. Dr. Clay Marsh, retired Major General Jim Hoyer, and Dr. Anam Jad are joining us today and are available for questions. We'll go straight to questions from members of the media. The first today from Veronica Obey with WDTV.
Thank you and good morning. I just had one quick question. When it comes to travelers, do we have a way of tracking them and knowing who may have visited places that have been exposed to the Omicron variant? And if not, is there a plan in place to find out that information, or how can it be tracked in general to know when it enters the state? Thank you.
Either General or Dr. Marsh, one of you guys, please.
Clay, I'll take a shot at it. Veronica, we don't have a specific system that would track people when they come across the state lines into West Virginia. So we rely on our epidemiology system and testing, and that's why we encourage people, like the governor just did, if he was around someone who may have had COVID or who had symptoms, then you go get tested. That allows us to pull data together and then to do some level of contact tracing and identify where that origin of their issue may have occurred. Thank you.
Thank you, Veronica. Next, we'll go to Katie Coyne with the Charleston Gazette-Mail.
Hi, Governor. Thank you. I know on Monday we did a reconciliation for booster doses, which brought us up to about 220,000, I think. But that same day, between Monday and Tuesday, according to the dashboard section on total people vaccinated on the vaccine summary page, there was a decrease of almost 27,000 fully vaccinated people in the state, from 849,000 about on Monday to 822,500 on Tuesday. Our vax rates haven't been that low, about 48.5% of eligible residents using those numbers from the dashboard since October by my counts. And another part of the dashboard says there are almost 867,600 fully vaccinated people here. So my question is, exactly how many fully vaccinated people are there in West Virginia? What is the reason for these changes and discrepancies on the dashboard? And what are we doing to ensure these statistics are being accurately shared with the public?
It's Katie, right? Katie, I'm sure if you watched the briefing closely, you could see that. I mean, while these things are difficult, I wasn't very happy. You know, I wasn't very happy that we spent a lot of money and we're tracking, we're tracking the number of vaccinated, the number of deaths and everything else, and you can see I wasn't real happy. And with all that, I'll promise you that that the folks that are on with us right now, the general and everybody else, I'm gonna have the general address the answer because he knows this way more than I. But all of us, are constantly trying to do better and better as far as the tracking. And at the end of the day, I'll pass to the general. I wasn't very happy, that's for sure.
Yeah, Katie, so you are correct. The numbers, based on the reconciliation, the total numbers changed. I'll give you an example of what the challenge that was faced by the DHHR team in reconciling data. If you recall, in the beginning, most all entries were done into the system referred to as VAMS, which is the CDC system. The VAMS system is not sensitive in the sense that, for example, if I got my first dose at one location and was entered in as James middle initial A Hoyer, then I got my second dose at another location, and that individual that entered my data in entered it in as James Hoyer, no middle initial, and then the booster dose got loaded at another location. Then the way the VAM system is not sensitive to correcting data, that would have entered me as 3 first doses, 3 different individual cases. So what had to be done in the reconciliation of data was to go in and do a series of algorithms and clean that up. Related to the transparency piece, that's why we put the information on the dashboard. So folks like you can look at it, ask us questions. We're happy to go through all the work that we do. We have a team of data scientists here at WVU that work data with the CDC as well as the state. I've got great confidence in Tim DeBar at DHHR, who manages data. But I think to your point is related to transparency, is that's why we put the data up and we put it there so people can look at it and ask us questions. And we work with an imperfect system. We also work with a number of providers who input data who may have input data a little bit differently. But we continue to work every day because, as the governor just pointed out, he presses the team every day to make sure we're doing the best we can to maintain a high level of accuracy of information. Thank you.
All right, thank you, Katie. Next, we'll go to Kenny Bass with WCHS and Fox 11.
How did answer? How many people are vaccinated in West Virginia?
General.
Katie, if you go to the front number on the front of the facing website, that is
I'm on it.
Are you there? That is the most accurate number if you look at the total numbers of vaccinations in that chart will give you the most current information that we have based on reconciliations at this time.
All right, thank you, Katie. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Thanks for.
Hello. Thank you for taking the question. I was just, as we're getting into the first week of December and then moving, of course, through the calendar and the holiday season, I wanted to ask, I don't know, whoever's looking at the data, maybe General Hoyer, maybe some of the medical folks, if they're starting to see any type of impact from the Thanksgiving holiday season, that week off where people might have taken off and then started gathering, if there's any kind of data or any type of early bells that are going off that you're seeing something that could indicate we're going to have a little bit of a surge from the Thanksgiving holiday. Thank you.
Maybe Dr. Amjad or General Hoyer, you're pretty popular today.
I can start, Governor, and then if Jim wants to add anything, Kenny. I do, because we look at the dashboard several times a day and talk to our teams out there. And when I glance at it, I see anywhere from 300 to 500 additional COVID cases every day. So to me, that's alarming. We do realize that a lot of labs and information were closed during the holidays, so some of it might be a little backlog, but our hospital numbers have stayed steady in the mid 500s. Our cases seem to go up. If you look at the dashboard, and you tend to write these down every day, but every day we see anywhere from 300 to 500 more cases in the last week. And then we know with travels and holidays, most people are likely exposed possibly to more people. But I would say, yes, I'm a little concerned.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the outbreaks in our nursing homes that we currently have. Do we have an idea of the source of those outbreaks? I know that, our nursing home population, were some of the first to get the vaccines, were the first to, be offered the boosters. So is this being brought in by staff members? Is this visitation from members of the public coming in? How are these getting into the nursing homes? Thank you.
I think Charles, General Hoyer had to drop, had another meeting he had to run to and everything. Maybe Clay, you could answer. Can you answer this, or I can't answer that.
Thank you, Governor, and thank you, Charles. Ein is probably the person the best positioned, but one of the concerning issues that we are looking forward to, again, as we start to scan other places to give us insights on what's going on, we know that as the weather has gotten colder and people have gone inside more, whether it's in Europe or whether it's in Michigan or Wisconsin or Minnesota, we are seeing an increase in number of cases. So we would anticipate that we will continue to see that. And we're very worried about the hospital capacity, as we talked about in great length last time. So we know that it's really important for a best protection status for all West Virginians who haven't been vaccinated, and that includes, family members visiting folks in nursing homes, people working in these facilities, as well as generally in our state, to make sure that if you're vaccinated with first and second doses and you're 6 months after that for Pfizer and Moderna, or 2 months after J&J, you get boosted, because we know that the potency of the immune response is not up to speed if you're in that 6 months after window. And the Omicron variant, which is the new variant that was initially identified in Africa, now we found our second case, and that case is in Minnesota, and the travel of that person was to New York, was not out of the country. So we know that the Omicron variant is also in our country and will become active in the upcoming weeks and months. which is even more reason to fully vaccinate and to boost people of all ages, as the governor said.
All right, thank you, Charles. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I'd like to direct this to Dr. Marsh. I know you look into a lot of things, and we've heard about the Pfizer pill that is currently under evaluation. What else is in the pipeline as far as treatment and prevention of COVID-19? And maybe are there any studies that you are waiting for to come out that would give you a little bit better grip on where this is going to next? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Paul. So I think you've hit the nail on the head, Paul. One of the most exciting developments in our ability to combat the serious manifestations of COVID-19 are the oral pills, one from Merck and one from Pfizer. In the clinical studies done, the pill from Merck has performed less well than the pill from Pfizer, but still offers a significant advantage. These pills don't have an impact or are not impacted by the mutations, say, that the Omicron variant has or that the Delta variant has, and they work more specifically on the really key parts of the virus that cause the virus to be able to replicate and to live. And in clinical research studies, the pill from Merck, which just, I think, got thumbs up from the FDA, waiting for the CDC, reduced severely symptomatic disease by 30% and reduced deaths by 90% in people that tested positive within 3 days of their symptoms starting. And the Pfizer pill, which is a combination pill, and it's called Paxlovid, it performed at an 89% benefit in preventing severe symptomatic disease and 100% in reducing deaths in people that took it within the first 3 days of symptoms. So these oral pills, which will be prescribed, are really important. But as the governor said, as we've talked about on this brief as well, the critical factor there is to identify people very early in the course of their infection and to get them treatment right away. So that first 3-day window is really critical. And so we're waiting for the FDA and the CDC to approve these two drugs. The other drug that is encouraging, although the new variant, Omicron variant, is making this, we'll have to wait and see, is an injectable antibody formulation from AstraZeneca, where the antibodies would be injected twice like a vaccine, and this would be done in people who are immunocompromised, and it would give them a more lasting protection. So it wouldn't be like an immunization, which would make their body make the response. This would be giving them an antibody cocktail that would last for 6 to 9 months. So as the Omicron variant is tested to make sure that the antibodies still work, this will be a preventive treatment for people who are immunocompromised who may not respond to the vaccine as well. But as we've said, the key is full vaccination, and if you're eligible, please get boosted. We have way too few people getting booster doses in West Virginia, and we have a highly vulnerable population. So that should be our number one priority.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, I think I can wrap this up pretty quickly by just saying just this. It's going to get cold. That's all there is to it. It's going to get cold. We're going to be indoors more. We're going to be at basketball games. We're going to be at lots of places and everything, at Christmas dinners and wherever it may be. Absolutely, without any question, there's more variants out there. Absolutely, the Delta variant is incredibly infectious. You need to be vaccinated. We have said it 10 million times. That's all there is to it. But at least the folks that are vaccinated, please listen to me and get your booster shot. Get it right now. There is no question in the world, nothing you are doing right this moment, nothing that you're doing right this moment is as important as you going to get your booster shot. That's all there is to it. And the last thing I'd end with is just this. Yesterday, you know, I'm exposed in you know, to people that actively now are sick and have COVID and was exposed on Friday as well. Same people. And lo and behold, you know, you've got choices. Now you can just sit back and wait till you feel bad or whatever, but if you have any anxiety, and I do about this, and I'm going to get tested right as soon as we get through here, you know, I think with the free testing that's available to all of you out there, you ought to listen to me. And absolutely without question, if you have any symptoms whatsoever, go get tested. Go get tested. If we catch this thing early, it's not a bad thing. But if we don't catch it early, you're in real trouble. That's all there is to it. That's all I got. And, you know, just hang in there, West Virginia. We're going to get through this, but we got to get through it the way we've got this far. Pull the rope together. Pull the rope together. Think about little baby dog, just 1 second. Think about her face. She makes you smile, and she absolutely loves everybody. And if we could just follow those rules, try to make other people smile, or yourself, and love everybody. Absolutely don't judge, just love everybody and try to help. Pull the rope. Thank you so much.